Okay, Winnie, so I'm going to show you a picture, and maybe what questions would you have for this person who's got some health trouble, and then what would be your professional advice for them? Does that make sense?
Yeah.
All right, so here is number one. Let's see. We got this guy comes into your office, and he's just generally like out of breath, feeling bad. What kind of what would be maybe one question you'd ask to this person about their health?
So I usually always start with what medical problems does he already have that he knows about. So we call that a past medical history.
Okay.
And it's important that we always ask that so we understand really as much as we can about the person before we start doing treatment. So we usually ask about past medical history and any medications that he's taking.
Okay,
And
that's a good one.
Yeah, and then we would ask about how often he's having this problem with trouble breathing and what makes it worse.
Mm-hmm. Okay, cool. What makes it worse? And then finally, what do you think would be just your let's say they've only got 5 minutes, they got to go somewhere. What would be your advice for them as they walk out the door?
Oh, that's a hard one, Joe.
Well,
with so little information.
Well, he is a cartoon character. He's yeah, you could say anything.
This is true.
You could say anything too, yeah. This is the fun. This is the joking part, the fun part, yeah.
I would probably say, no offense to Peter, I believe his name is.
Yep.
Is that I would want him to gradually watch his diet and eat a little healthier and maybe try to get 20 minutes of exercise a day, but to start slow, and his body will eventually get used to doing that bit of exercise every day.
Okay, wow, that's a lot of good advice. So, excellent. Watch your diet, eat healthier, and get 20 minutes of exercise a day. That's good advice for anybody. Okay, ping pong. So correct. You got it right. Correct. Okay, so number 2 is what question would you ask, and what's your professional advice if this guy walks into your office and he doesn't actually say anything. He doesn't say anything. So he walks in looking like this. What would be your first question? Or yeah, what would you say?
I would say, what happened to your face?
What happened to your face? Okay, ping pong, that's correct. Yeah, something crazy happened here. And then, they seem to have some kind of skin trouble. So what would be your professional advice, even though it's not, it's a skin problem? What would be your professional advice here?
My professional advice would be to probably clean that side of his face 3 times a day to make sure it doesn't get infected.
Oh, oh yeah. Very good advice. Okay, so ping pong again. So what happened there to your face? And secondly, you should clean that side of your face 3 times a day to stop infection. Infection's a good vocabulary word. Okay, 3 times a day, yeah. Okay, ping pong, very good. We're going to move on ahead to number 3. Let's see, I forget who it is. Let's see, who could it be? You got a lot of crazy characters coming in. What if, oh my god. So this person, their friends brought them in, and they don't know what to do. They've never seen this before. As a doctor, you're the only doctor there. What would you say? What would you ask? What would be your questions?
I probably, again, would ask, what happened to your face?
Okay, what happened to your face? Okay.
And I would maybe ask how long that's been there.
How long has that been there? Okay, that's a good answer. I don't know what it is. Maybe how long does it take for the alien to come out? Maybe a few hours, kind of. Yeah, maybe it's too late. All right, so we'll say ping pong again. Let's see. Moving ahead. What questions do you have? I forget. Who is it? Who could it be? Oh my god. So this person walks in, not making much sense, looking for something, really going crazy because they can't find something they're looking for. And they just really they got all kinds of problems. What would be your question to this guy?
I'll say, this character looks like me.
What? That's
When
kind
I
of
was surprising, yes. When I was surprising, the character looks like me. Someone say like that.
what in the world? Jeez.
I don't know. I'm not happy with that, but like me.
Yeah, that's pretty hidoi. All right, but Winnie, do you have any questions about this person's current condition?
I would ask him where the last place he remembers having this thing.
Where was the last place you had this special thing? Okay, that's a good question. And then they seem to have some kind of stress in their life. What would be your life advice for this person?
I would say don't stress out about it. It's always in the very last place that you looked.
It's always in the last place. That's a good. It's always in the last place you. Okay, that's also what my mom says to me when I can't find something. So.
She's very wise.
Yeah. So don't stress out. It's always in the last place you look. Okay, good. All right. Oh my god, we're gonna keep going. Okay, how many do I got? I don't even remember. I didn't mark them. Number 4 maybe. What is okay, so this guy looks like pretty fashionable, but if you've seen the movie, he's got problems as well. What do you think kind of questions you'd ask this guy walks into your office?
I would ask him, Yeah, I could either take it very dark or take it very funny. Let's see.
Oh, yeah, go with your, use the thinking music. The thinking music helps.
I would ask him who does his makeup for him.
Who does your makeup? Okay, excellent. All right, and then so given, he's got problems too. I think he has like a laughing condition, and he's just got dark thoughts about his life. What would you give advice to this guy? What kind of advice would you tell this guy?
I would advise him to keep coming back and seeing us for medical care,
okay.
and to maybe open up to a therapist.
Mm-hmm.
And then here's where I'll go very dark, but I would tell him that if he ever had thoughts of hurting himself or other people, that he needs to come for a medical evaluation.
Very good.
Because first and foremost, as a doctor, we care about people's lives and want to make sure that they're safe.
Yeah, definitely. Okay, really good. Number 1, who does your makeup? Number 2, you should keep coming back and seeing us, and maybe speak to a therapist. If you ever have thoughts of hurting yourself or others, come for a medical evaluation. Very cool. I think that might be the last one. Let me just check. Is there one more? Maybe. I think this is the last one. This guy's actually about... Oh, maybe I don't have any more. Nope. Any question for this guy? This guy's about 700 years old.
My question would be, who is the fella putting the sword in your head?
Yeah.
And my advice would be, I don't recommend that you be friends anymore.
Oh. You should stop being among friends. Okay, good. All right. Who's the Filipino? Okay, good. Okay, excellent. Okay, that's about 6. I think that's got to be the last one. All right, cool. You got them all correct. Of course, not unbelievable, very believable because you're a super trained professional. So you got 6 out of 6. That is the end of the game. At this point, thanks. We're overtime, but does anybody have any? Is there any like burning questions for Dr. Winnie, Dr. Lau? Nobody?
I have question.
All right.
I had a special nurse wear a white coat, and I am a pharmacist. I every time wear white coat in my pharmacy, at the pharmacy.
Mm-hmm.
American pharmacist, do American pharmacists wear the white coat?
Do American pharmacists?
Yeah, so American pharmacists oftentimes do also wear white coats. More often if they work in a public pharmacy, so like inside a store where you pick up your prescriptions, they're very likely to wear white coats. And perhaps you know this because you're a pharmacist, that there are different levels of pharmacists. And there are also pharmacists that have what we call a doctorate degree. They have a PharmD. The D
Yeah.
stands for doctorate. Actually, both my brother and my sister-in-law are both PharmDs. So they, oftentimes I see the PharmDs wear the white coat because they have what's called a doctorate degree in pharmacy.
Wow.
So my brother likes to ask me to call him doctor as well.
Oh, really? Okay, cool. Okay, cool. All right. At this point, that's a really good question there. I always forget to do this, but not today. Winnie, do you have any questions for these people about Japan or anything? Now's your chance if you have any burning questions.
I absolutely am planning to visit Japan again.
Mm-hmm.
And so I would like to know if anyone has recommendations for me where I should visit. Maybe it helps if I tell you where I've been. Like most travelers, I've been to Tokyo, Kyoto, and Osaka.
Mm-hmm.
I live
But
in Tokyo.
I am open to traveling elsewhere in Japan as well.
Mm-hmm.
I live in Tokyo, so if you come to Japan, I can make some recommendation to shop, some good sushi shop and restaurant and place I can tell you.
That's a very kind offer.
Yeah, you could be a visiting professor.
Yeah, maybe my professor will be really happy to talk to the foreign person.
That'd be awesome.
So, yeah, maybe please talk with him.
All right. Anybody have recommendations?
I have some question. Maybe
Wait,
this.
hold on. Anybody want to recommend somewhere to Winnie's next trip though? I think nobody.
Okay. I hope you should come Fukuoka. So have you never been to there?
No, I haven't.
Yeah. Actually, Joe lives in Fukuoka, and I live in Fukuoka. So if you come here, I'll show you around. There's a good lot of ramen shop.
Mm-hmm.
Ooh,
that is correct.
You've already hooked me. You said the magic word, ramen.
Yeah. Oh man, yeah. Fukuoka is kind of the best place, and it's a little bit too far down the line. You have to go past Hiroshima, but if you do make it down, it is kind of the coolest, but not so crazy city. Like Tokyo is too crazy for me. Even Osaka a little bit, but yeah, here is the best. We got anybody else? That's nothing else. Well, we should probably let her go. Or Gomen, Kanon, you want to ask one final thing? Final?
Okay.
Just my personal question, because there is some October, maybe there is SFN in New York, maybe Washington. Are you going to join the seminar?
Is some kind of seminar, SFN in New York? Do you know?
Yeah. Society for Neuroscience.
Okay.
Will not. I'm actually not familiar with that particular conference.
Yeah.
So I'll look into it. Normally, I will attend conferences more for intensive care. And then I know that one of the neurology conferences next year, hopefully, if we can travel, will be in San Francisco, near Joe's hometown and near to my family. So I will probably go to that.
Thank you.
There you go. All right. So with that.